Welcome. Kwamane, we're going to come to you in 1 second because I think after an introduction like that, it's important to really celebrate what you've just achieved. But we're gonna do a little bit of a lead-in first, okay? And the history of community health in this country, for those of you who don't know, is really made up of a bunch of well-intentioned, well-meaning people and organizations who have brought care and information and preventative services to those who are really disconnected from traditional healthcare systems in this country, but also who have a real trust issue with a lot of the healthcare systems in this country. And these efforts, which have been really human capital intensive, have been impactful. The problem is they really haven't been able to scale, because to scale effective programs, you need technology. And technology up until now really just hasn't been efficient or affordable for people in this space. And you just heard what Kwamane has done at ThriveLink, and it's Kwamane, and see, that's why I was stopped, but Kwamane has done at ThriveLink, and you realize we are at an inflection point where technology-driven innovation is affordable and efficient, and I think over the next couple of years, we're gonna see huge change in this space, and this panel is gonna focus on bringing impact at scale to community health. And before I get to Kwamane, I think I want to start with Eric Berger, who's all the way to my far left. Eric is a senior partner at Bain & Company, and he focuses in the healthcare and life sciences space. And he sees a lot of things across the whole spectrum in healthcare. And Eric, could you just comment on what's been happening the last couple of years in unlocking data sets and developing AI tools, and how it's going to have a real impact in healthcare?
Yeah, I'm happy to. I think you're right. In the past 5 to 7 years, we've seen this acceleration of innovation. And so there's this theory of punctuated equilibrium where it speeds up. The amount of innovation that happens comes in these spurts, and we're in one of the spurts now. If you rewind maybe 5 years ago, we had these moments of magic where you're like, holy smokes, AI is achieving something we never thought possible. Then maybe in 2023 or so, we entered this period of thousands and thousands of mushrooms blooming, as one CEO put it, where there's all of these really good ideas that grow to be about 2 inches and don't go anywhere. And so what's exciting now in 2025, in the next few years, we're gonna see the survivors of that period start to scale and build on the immense amount of work that's been done to bring data together, to unlock new data sets that weren't accessible before, to bring applications that can unlock and work with that data, and then most importantly, think about ways to do it that are not just kind of high science and Nobel Prize winning applications, but work all the way down to the way providers work, back office staff work, and then out in the community, whether it's at a community health center or a food bank and other things, you're gonna see the amazing power of this technology change the way people do what their jobs are.
Well, so we're gonna go from that high science. Kwamane and ThriveLink have taken the power of AI and created an application, a functional application for people who maybe can't read, have language barriers, don't even have a smartphone, to give them telephonic access to essential social services, really changing their lives in ways that are hard to describe. And Kwamane, can you talk about how AI is, well, talk about what you're doing at ThriveLink, but talk about how it would not have been possible without AI tools.
Yeah, to give a bit of context, I'm an emergency department nurse. And I jokingly say I was a travel nurse before it became cool. And I traveled to hospitals all over the country, where both in rural settings and urban settings, there were so many people who were losing their lives or well-being, not because they needed more healthcare. We worked in incredible health systems, but they needed food, they needed housing, They were prescribed this medication, but they couldn't afford it. And there were just so many programs, and probably every doctor in here can think of a time where they prescribed a medication and had to make sure it was on the formulary so that their patients could actually afford it, and had to go back and change the medication, probably every day. But there was no easy way as a provider in real time to solve that for every single patient that came through the emergency department that we supported. And ThriveLink started out, I was at the county hospital in Oakland, it's called Alameda Health System. And it started out as just a nonprofit where nurses, we would just volunteer to help people fill out paperwork and just get into those programs. It was a good idea in theory, but we were surprised that there were so many people that needed help. And where ThriveLink was born, it became a recording system initially, where people could just record their answers to these applications, and then someone would be able to go back and fill it out for them. Now, families can just have conversations over the phone. They can sign up for medically tailored meals, food, housing, transportation, and all those things. But there are two things that are the superpowers as we described. AI has allowed us to say, you don't need a smartphone, you don't need the internet. You could just talk over the phone and be able to do that. That's the technical piece. But the piece that may be even more important is the workflow, where we created something using my nursing experience, volunteer nurses. We went into homes of patients who allowed us to come there. Let me understand what's happening with you. What do you need? And there are some things that we learned really quickly, especially moms, where in order to get help with something like food, maybe you have a child and it's just your first time being a mom, and you're new parents, and you realize a car seat is really expensive, and they're not easy to put into a car if you ever put a car seat together. But there are programs that help them with that. Just things that are that simple where people could just have that conversation and be able to navigate it to those programs have been transformational. I give one quick example. We work with an organization in their emergency department, and there was a patient that came in the doors. He needed all these things. He needed all this help, but he didn't tell their provider when they screened that he was homeless. So they prescribed these medications to get delivered to him, medically tailored meals, all these things. He found a phone somewhere in the community, maybe a payphone. He talked to our AI agent, and he had his medication and his food delivered to the car wash where he slept. The reason we found this out is because our agent also allows you to schedule doctor's appointments, and he went to the doctor. And the doctor asked him, how do you get here? We have been thinking of ways to support you and people like you for years. How do you get into this system? And he said it was the first time that he himself independently could navigate himself into that system. And it's just been such an incredible experience where we're making it easier for social workers. They're enjoying coming to work because they don't have to do paperwork all day. We're taking away so much of those easy things. Health systems are able to engage more people because there's more automation. We're just so excited for this platform and the Kraft Prize and all the work that you guys are doing to help us build this system and make it even better, and to just expand our voice.
Kwamane, Kwamane, can you just, before we move down the panel, can you talk about how many families you've been able to impact so far, and also, for a lot of us who are fortunate to be in this room, just the idea that having to read a form, is a barrier to applying for something, I think is inconceivable to a lot of us, and yet that's what a lot of the families you're helping were facing, just to access essential services. So could you maybe just comment on those two pieces quickly?
Yeah, we've helped, we launched last January. We helped over 4,000 families, and that accounts for about 10,000 people. And the stories are just so impactful. For example, there is a family, a woman who was in her 70s, and she used our platform to sign up for the Boston Housing Lottery and won. And it was her first time having her own home at 70 years old. And it was just because she qualified for a long time. She just needed something or someone to help her do the paperwork. It's just been really exciting.
That's great. Thank you, Kwamane. Elsie, Chief Community Health Officer at Mass General Brigham. Elsie oversees the largest community health effort in this state, and really one of the most, if not the most accomplished community health efforts in the country. What, in your role running community health for such a large system, what do you see as the barriers to bringing technological innovation to community health? What's your role in knocking those barriers down? And how can you help people or organizations like ThriveLink accelerate the distribution of their products?
Well, so first I want to join all of us in, again, congratulating Kwamane and really for ThriveLink's work that was recognized through the Kraft Prize for Excellence in Innovation in Community Health. It's our inaugural year, and we couldn't be more thrilled to choose a winner who is really thinking about and using community-centered design to help the communities and improve health outcomes. As I was thinking about this question of kind of historical barriers, I think Kwamane and ThriveLink is such a perfect example of the winner of what we were looking for as the mission of this prize, because ThriveLink is tackling the historic barriers that I would say come down to three. The first is misalignment in creating community health solutions that don't have that community at its center, right? So we have a lot of tools that we all know about and that we've worked with that are designed for health systems, that are designed maybe as research tools, but aren't necessarily designed to kind of get at the pain point for clinicians of what we need most when we are seeing a patient in their emergency department or in our primary care system who is struggling with hypertension but is also hungry, or is struggling and has diabetes but doesn't have a refrigerator to put their medication in to be able to help them with their diabetes treatment. And so that alignment that ThriveLink is doing and that we look for in other solutions, right? An alignment with what are the pain points for a clinician, but what are the things that we need to solve for? What are those kind of precise issues that our community members, our patients are facing that we can solve together for? I would say the second barrier is fragmentation. Oftentimes, we have innovations or solutions that don't sync up with existing public health resources or existing public health efforts. The best example of this during COVID was wastewater surveillance. Everybody, we used to use wastewater surveillance to pick up on hotspotting. During COVID, we use, in the Kraft Center at Mass General Brigham, we use new technology to be able to use that wastewater surveillance to match to the street, to the block, those hotspots that had the highest burden of disease for COVID, and match community caravans bringing our newest therapeutics, our testing, our vaccines to those same streets where wastewater surveillance and testing of that wastewater surveillance was showing us we needed to go boots on the ground to tackle that problem where it was. We don't usually have that ability to have the solution sync up with existing public health resources and not so much in real time. And I would say the third thing that Kwamane has done through ThriveLink, which made it, as Robert said, such an amazing opportunity to recognize, is some of the historical challenges has been trust. You don't gain trust from a community by popping in and doing sporadic assessment of what are the community's needs. You gain trust and you gain that ability to scale and disseminate within a community when you are present in that community, asking for co-design, asking for feedback to iterate on an innovation. And I would say there's a very good reason why ThriveLink won. So what's our role? I'm a pediatrician, but I also get to vet and bring alignment in all of the innovations that are happening that are just such incredible solutions for some of our most vexing issues, and be able to vet those to bring to the communities where we have gained that trust. I see myself as kind of an agent in some ways for bringing the best of what we know works and accelerating the pace with which what we know works is what we do in everyday practice. And really grateful to be able to do that, grateful, as Chris Coburn said, if the innovations that we see, that you all are helping us bring to the market, if they stay in the market and don't reach the populations that the Kraft Center was built and the mission of the Kraft Center is built around, then we have failed an entire population, we have failed an entire community. And so we're really proud to have this platform, to have the ability through Mass General Brigham, through the Kraft Center, to really be that bridge between breakthroughs and reaching through boots on the ground the communities that need it most.
Thanks, Elsie. So our fourth panelist, Damon Martin, who happens to be a good friend of mine, full disclosure, and I also am a small investor in his new business that we're going to talk about. Damon comes at this from a totally different perspective. He spent the last 2+ decades working in the investment field, like much of you, and before that, he did learn a little bit about public policy and the importance of it because he worked in the Clinton White House and went to Harvard Business School from there. But Damon left the investing world a couple of years ago to go out and see if he could work on the issues of trust that Elsie just talked about, but community health from a consumer product perspective. And so he started a business called WellWithAll, whose mission is to create products that are better for the communities that we're talking about, but who also has a mission of taking a significant percentage of their profits and putting it back into community health efforts to service the people whose health needs are underserved. And with that, Damon, I would just ask you, what was your inspiration to do that? And do you really think you can improve health outcomes at scale with consumer products and this unique virtuous cycle approach that you're bringing to it?
Absolutely. It's great to be with you all. How's everybody doing? I love it. I love, I come from a Baptist tradition, so I like a little interaction with the crowd, so stay with me. I'll go all the way back just really quickly because it gives context. The way I describe my life is I've lived this improbable but possible life. I grew up in poverty, lived in a wide variety of places, including Inglewood, California, had a heroin addict as a stepfather. And then, got a series of incredible breaks, lived with my father in rural North Carolina in a trailer, and then went to UNC Charlotte and got great mentorship and opportunity. My first job out of college was assistant to the White House Chief of Staff in the Clinton administration, then got into Harvard Business School, became a Kraft Fellow, which was super helpful because I had zero money. And that allowed me to propel myself into a career in finance and worked at Adage Capital for 21 years, was the only black partner at a major hedge fund in the country. That allowed my wife and I to be philanthropists and focused on health equity and education. And then 4.5 years ago, I was standing in the middle of an emergency room with someone that I love dearly, dealing with depression, anxiety, and was suicidal. And we dealt with 3.5 years of suicidality with this person that I love. And what I realized with great clarity is like now I'm on the other side with all of these resources and opportunity. But when I was a child living in a trailer in rural North Carolina, had this happened to me, I'd be dead or in jail. And so many people are in that position right now. And the one thing that I would say before I talk about WellWithAll is that we have incredible investors. We've got a lot of resources in this room. People need help right now. People need help right now. And we're in a moment where we need innovation and to do something different. And so what WellWithAll is a health and wellness consumer products company. We take 20% of the profits, right? Self-interest is essential, but selfishness is not. We take 20% of the profits and we use that to impact health equity for those who need it. And the question about, can we help at scale? we already are starting that journey and are being very successful, but we do need innovation in the way in which we're talking about, because the government and nonprofit and philanthropic organizations can't do this alone. Capitalism is desperately needed, innovation is desperately needed, and that's what we're working to drive. One of the things that we're launching in the coming months is a WellWithAll Prize, which is focused on, we'll give away $1 million of prize money focused on AI-driven ideas, and we hope to have 1,000 ideas like the ones that you so have thoughtfully crafted, because there's a desperation for innovation, and there's a true need for things to be done differently, and capitalistic ventures are going to have to lead the way in being helpful with all the great work that's already being done.
That's perfect. One follow-up to that, Damon. You talk about, or I've heard you talk about, investing in outcomes as opposed to ideas. So I'm curious how you're going to go about judging the elements of that prize, because you're a believer in tangible bottom line results as opposed to conceptual ideas. And is that going to be how you approach that part of what WellWithAll is doing?
Yeah, I mean, we've all seen billions of dollars spent, with not the kind of efforts that you've, been able to drive. And so I think that as we approach these ideas, they have to be impact oriented. I mean, it can't be a feel good, philosophy around the effort. It has to be the actual impact that's being driven, and a criteria. You won't, like your prize, you won't win the prize unless you're actually demonstrating that you're causing effect and that can be scaled.
Great.
Jonathan, can I add an exclamation point after that? Because I think we've held for so long outcomes in community health to not to that standard. And in some cases, we've done a lot of things that feel good, but don't work. And I think, I've worked really closely with Eric to design and create a strategy that is focused on accountability, even in community health, even for vendors, for innovations, to drive results, to drive outcomes. And I would say that some of the most challenging things, Damon, to your point, is we have to get away from that sense of it feels good, so we're going to keep doing it. The communities that all of us are serving don't have the time or patience for us to figure it out on the way and not hold ourselves accountable to outcomes. As an NIH researcher who's received multiple grants for clinical trials, I would never get my research funded if I wasn't held accountable to outcomes, to showing the return on investment on the millions of dollars that I have gotten in grants. And so in some ways, we shouldn't hold community health and outcomes in community health and impact in the same way to a different standard. And so I completely agree with you, Damon. I think one of the things that we need to shift is that rigor and shifting to accountability to outcomes in community health, which is really, at the fingertips of being able to use these innovations to do just that.
Yeah.
Can I just add one thing? I mean, when we hear about underserved communities, we often focus on, sort of the negative things, the rate of death, et cetera. There are communities that are actually thriving. There are folks, who are represented, in these communities that are living long, healthy lives. That story oftentimes isn't told. When Uber launched, immediately there was replicas of that across the world. That doesn't happen typically in health equity, doesn't happen typically in the nonprofit world in general. And so finding those ideas that are working and scaling them is really the key.
Go ahead.
I was just going to build on Elsie's point. I think it's outcomes plus making use of resources and ideas that are available, which I think is one of the elements of the model that works so well. The story you told about connecting people who are in need of resources to the existing things, it's not a matter of net new to world innovation that needs to be discovered, but it's using technology as this point of connection that can accelerate the results.
And I'll say, I wait to tell people I'm a lawyer too. Just there's so many things. And so before doing this, I led a major health system, the largest nonprofit health system in the country, and at the largest medical group in the country. And when we began to build this organization build with being ThriveLink, something that I was really surprised to see is I agree with what this panel is saying, but investors are like over here somewhere. So I really think that's an important thing to understand for investors in the room, especially in the AI world. The old algorithm of who's on the team, what is this thing, that doesn't apply now because things are being built exponentially faster. In the time that you do diligence, you've covered 7 to 8 technical milestones that couldn't be done 4 years ago even. So it's really a really interesting thing for me to see now as we talk to investors and how they are thinking about choosing startups and things and choosing investments, is that they are, and I encourage investors to begin to understand that the technology, the way you evaluate technology, the technical part should be very different. You should lean a lot more into what are the outcomes, how quickly are they working with different organizations in their workflow, what is actually happening with the thing that they produce, less than do you think they're going to be able to further scale this thing? Because the answer is probably yes.
So Kwamane, you just teed up where I want to go with this perfectly. So we've talked about scaling initiatives, but in community health in particular, sustainability has always been a real issue because so much of community health is funded through short-term grants, be it from the government or from philanthropists. And really, to be effective, we need to make sure that this innovation that's coming along that's going to allow us to scale can be sustainable. And I'm going to come right back to you, Kwamane, to talk about what I'm not sure everybody understands is that as you continue to provide your services, not only do you get smarter, coming down the experience curve and training the agents, but you should become more cost effective. And you started your organization because there wasn't a functioning model to help the people. You couldn't afford human intervention. You figured it out. So can you just talk about the sustainability of the current model you have, that you have at ThriveLink?
Yeah, I'm going to talk about it in these different buckets, meaning the things that make sustainability real, the things that the reason why it works. So one of the things that we think about is we build ThriveLink because when we build ThriveLink, it has to be affordable for FQHCs, federally qualified health clinics. It has to be something that Medicaid plans can afford. It has to be something that can be deployed over a long period of time in low resource communities. So the first thing we had to do was think about the business model, something where the health system can afford it, the clinics can afford it, but there's something where the health plans also participate. So one of the things that we do is ThriveLink is a subscription model, and there are tiered subscriptions based on the size of the organization, but it's also something where health plans pay when patients use it for different things. Probably the most common one is medically tailored meals or transportation, or even annual wellness visits. So we contract in a way so that the burden is not on any one organization, yet they all receive some sort of value. The second thing is partnerships with health systems has been really important. And something that we've been blessed to be able to do is we have this thing we call it the land and expand model. We'll go to the biggest health. We work currently with two of the hospital systems that own the most hospitals in America. But we didn't go there to say, hey, we're going to cover all 180 or so of your hospitals. Let's do this with just 1 or 2 hospitals in this market that really needs it. And being able to work with organizations who are able to look at this really large problem and test it in a smaller place has been really important. And that's even prizes like this one, working with Mass General Brigham, is really important for us because 2 things happen. We know for sure what to build. So there's very little waste on our teams where more than 90% of all things that we've ever created has been something that doctors have asked us to build. Nurses have asked us, patients have asked us. They've told us, hey, if you can make it so that I don't have to press the referral button, it'll just go to the patient, then I love that. And that's where we spend our time. The third thing that we think about is being able to create something in partnership with organizations over time. So as we build our roadmap, we build it with our partners. And right now, a really important thing that's happening is different programs are losing funding. Maybe it was government funding, maybe it was grant funding. So now we were primarily working in hospitals, but now we're also working with governments. How do we make your SNAP program a little easier? How do we allow people to go ahead and report their hours because they're already here for Medicaid, they're already here for medically tailored meals? What's that other really easy thing that we can add that'll be extremely beneficial to the larger ecosystem?
That's great. So Eric, when we talk about sustainability, there are still a lot of people in the business press that I read who talk about AI being overhyped and there aren't practical applications and this is going to lead to a bust. You see the impact of artificial intelligence across a wide range of organizations, from not-for-profit healthcare systems to life sciences business doing research and development. Do you believe that AI is a sustainable element of society going forward? And how is that going to help healthcare efforts both in the community and the for-profit space?
Let me answer two of the questions. Is there a bubble and is there hype? Yes, and it's certainly the latter. Will it have a lasting, durable, sustained impact on many of the jobs that exist with it throughout the healthcare system? I think yes, for sure. And I'll elaborate in two ways. One, my very first job in high school was essentially fetching photocopies of journal articles in the Conant Library at Harvard for a postdoc. And then the second summer, I was there in the same lab doing the same research. The list of Post-it notes, or the Post-it note with the list of journal articles went away because PDFs were invented. And so I could download all of those articles, hit print, and just what was a 6-hour exercise became a 10-minute exercise. That is going to happen and is happening, present tense, with a variety of jobs kind of throughout the healthcare ecosystem. It is most pronounced, and I think we can talk more about it, in jobs where if you read the job description, you see read or write are in the job description, which is a relatively high proportion of jobs. Those jobs are changing. And so, there are classic examples where entire organizations and teams have been displaced because of it already. And we're just going to see more and more examples of that with work where if the job description is to read or document or summarize a big body of work or translate, those jobs in the next few years are 100% going to be, I don't know, I wouldn't use the word replaced, but they're going to be disrupted, and the nature of that work will change. And I think one of the things ThriveLink is doing is it's spotting those pockets of opportunity where there is such high degrees of manual work and kind of automating it.
And will it have impact? Will it have impact on society though, with health, especially in the community health space outcomes?
I think yes, because all of that time, energy, money will be focused on working with patients and doing things that are more productive than what I used to do at photocopy journal articles or process prior auth requests or manage denials or kind of throughout all of that.
Go ahead, yeah, please.
Yeah, I think there's actually some really good news in the context of this. There's a lot of nonprofit organizations that are strapped for resources and can't bring in, the quality of your consulting and otherwise. And I think, and I just did this with a great organization here in town. They had all this stuff written on a whiteboard, things they wanted to think about, strategy that they wanted to consider. And one of the benefits of something like ChatGPT is you can say, given the context of this problem that I'm dealing with, act as a COO or act as a head of marketing or act as a head of strategy and give me, 3 possible scenarios that my organization should consider. And that level of interaction is something that most non-for-profit organizations don't have the benefit of engaging with. And so I think that the efficiency that could come and the effectiveness of just a conceptual thought partner of all of the strategy books that have been written, bringing that into an organization within a day has a powerful set of outcomes.
So you're a for-profit company and you're getting to work, but your mission is an important one. And is it going to help you be I mean, you're going to be sustainable, but is it going to help you as well in the for-profit?
It's helping us scale faster. It's helping us, have to use less capital. It's allowing us to be smarter, faster, more effective and efficient, which means that we're more profitable, which means that we help more people.
Perfect.
And I'll add something I'm seeing. In real time, hospitals are already saying, hey, we have social workers. Use this thing that helps the patient do the paperwork. Then for the people who are not able to do it on their own, then go and use the human resources so that they can focus on patients who are being held because they have they can't be placed into a different care setting, or they have behavioral health issues. And you're seeing that real benefit and that cost savings right away.
Perfect. Elsie, as you think about the long-term services that you're providing to the community and the limited budgets that you have to deal with just by the nature of all the competing demands in a large healthcare system, how do you think about what you want to pursue and get the most out of the budget that you have available, and obviously how will technology feed into that?
So some of the best initiatives that we have launched have come from public, private, and philanthropic partnerships. And those are the best because those allow us the opportunity to fail if something's not going to work, and fail quickly so that we can learn from those failures and iterate and improve. Ultimately, I think about my CFO, who might be in the room. His question always, as he's approving budgets and thinking about allocation of funding, is, tell me what outcomes I am paying for. What outcomes are in the budget of an initiative that we are launching in a community? What's that buying in terms of hypertension that's controlled, diabetes that is managed, colorectal cancer that we caught because we screened early, someone that received treatment with buprenorphine for their substance use disorder. And ultimately, as I think about my budget and allocation of resources, it really comes down to, what am I doing? What are the decisions I am making in where I spend my budget based on what income and what impact and what outcome I can get from the investment. So these days it's all about, how do I drive our resources, our investments, to make really good decisions based on where I'm going to get the best outcomes and results. And that's why looking for innovations, looking for ideas that are in the marketplace and out, through some of the work that other Kraft Center initiatives that are out there, that are out in the community, looking for those opportunities for those demonstrations and proof of concepts is what I use to be able to vet where to invest our resources.
Great. Well, scalability and sustainability means we're probably going to get to a better place. I want to close with just a very quick lightning round. And if we get this right, using technology to drive innovation that can scale and be sustainable, very quick 10-second answers from everybody. What will we be celebrating 5 years from now in the community health space? And Eric, it's going to be unfair. I'm going to start with you and just go down this way. 10 seconds.
I would say greater control of hypertension in underserved communities.
That would be a good one. Elsie.
Well, he stole mine, so I'm going to say, as the executive director of the Kraft Center for Community Health, that we will see thousands of applications for our Kraft Prize for Excellence in Innovation in Community Health.
If you look at Back Bay versus Roxbury, they're 3 miles apart. The life expectancy difference is 23 years. When we are effective at this work, those life expectancy gaps will decrease and decrease until there's not a gap anymore.
That's a good one.
I think you're going to have exponentially higher engagement from a community health and population and value-based care perspective, simply because it's easier for people to just do the things, whether it be get a mammogram and all those things. And it's going to be 10 to 20% cheaper to operationalize healthcare provision.
Great, thank you. Just as it went to zero. Thank you, everybody. Really fun.